Hi, everyone. I'm Christina Baumann. I'm the health officer with Washington County. And I want to start out with talking about what we're seeing in public health and how we're responding. So the rapid rise in cases has made us change how we're doing our work. We are definitely prioritizing reaching out to reaching out to cases so we can identify where there might be disease spread and focus our resources on stopping the spread where people are most vulnerable to getting very sick. So we're diverting our staff to focus on that. And in so doing, we are asking the public to help. We are asking for your help first and foremost to take precautions to stop the spread of the virus and to avoid getting exposed yourself. The other way that we're asking you to help is that if you do test positive, if you have COVID-19, please reach out to your close contacts right away. Public health is doing our best to keep up and to do our outreach and education, but the fact of the matter is that your outreach, your calling your close contacts and notifying your employer will be much more timely. So in calling your close contacts, we are asking that you tell them that they've been exposed. Ask them to quarantine for 14 days since their last exposure, watch for symptoms, and get tested. We know that this is a lot to take in, and we have results put together in the region, something that we're calling the After You Get Tested Guide. This is available on the Washington County website, and it's also available on the Multnomah County Public Health website. It walks you through all of the important information, including how to figure out how long you've been contagious, who to prioritize in notifying as a close contact, and also some tips on how to do that notification if you're uncertain how to begin and what information to give. So please, we're asking everyone to take a look at this guide. It has a lot of useful resources and information. And if you test positive, help out public health and notifying contacts yourself. The other way that you can help, and we mentioned how quickly the virus is spreading. This holiday that's coming up, Thanksgiving, as with other holidays, people get together and the virus spreads when people get together. We also tend to drop our guard when we're around people that we know. We don't take the precautions that we otherwise should. With Thanksgiving falling in the winter months, we will be celebrating together indoors potentially, and that's a big risk for spreading the virus. We are, as Dr. Sani mentioned, as public health, as healthcare providers, very worried about what December is going to look like. And so we have to ask that people really strongly consider changing their holiday plans, changing their Thanksgiving plans. Please gather in smaller groups, don't travel, and protect your friends and family members who are older because they absolutely can get very sick. We are very worried that we'll be hearing some sad stories going into December if the usual Thanksgiving gatherings happen as they have in other years. This is not a typical year. We are in the midst of a pandemic, and we are also at a time where we are seeing a lot of virus spread. So please take that into consideration as you think about how you're going to celebrate Thanksgiving. I can tell you that I and my family have absolutely thought hard about this, and our usual Thanksgiving, since my family and my husband's family are all in the Portland area, involves having 2 days to gather together and have meals at our households. We typically have 4 to 5 households coming together, and we are not doing that this year. It is not safe. My parents, who are in their 70s, are going to celebrate at their own home. My sister's family is going to celebrate at her own home. And I'm going to celebrate at my own home with my husband's sister and her husband. And the way that we're going to connect is by video. We will share our toasts and our Thanksgiving and spend some time together virtually. That's the safest choice for us, and a way that we can avoid adding to the spread of the virus in our community.